right now, while you sit there watching this, a hormone you have probably never heard of is quietly telling your liver to dump sugar into your bloodstream. Not because you just ate something bad, not because you skipped your medication, not because you did anything wrong at all, because you are not drinking water correctly. And here is the part that keeps me up at night. According to a landmark study published in the journal Diabetes Care, researchers tracked more than 3,600 adults for 9 full years. What they found was staggering. People who drank less than 1 liter of water daily had a significantly higher risk of developing type 2 diabetes. Not from their diet, not from their genetics, from dehydration alone, because of a single hormone your doctor almost certainly never mentioned. 93% of people managing blood sugar right now do not know this hormone exists, and the system that is supposed to help you has no financial incentive to ever tell you, I'm going to tell you today. Every single thing, starting right now. What country are you watching from? Drop it in the comments right now. I read every one. My name is not important. What is important is this. For 22 years, I worked in internal medicine, seeing patients who were doing everything right, taking their metformin, cutting their carbs, walking 30 minutes every single morning. And still, their fasting glucose refused to budge, still showing up at 150, 160, 170, still frustrating, confusing, demoralizing. And I kept asking myself the same question, what are we missing? The answer was hiding in plain sight. And it was sitting in every patient's kitchen, untouched, on the counter, next to the coffee maker. But before I go any further, let me be completely clear about something. Everything I share today comes from published research and 22 years of clinical observation. This is not a replacement for your doctor's care. This is the conversation your doctor does not have time to have in a 7-minute appointment. Keep taking your prescribed medications. Bring this information to your next visit. A good doctor will welcome the conversation. Now, let me tell you about Sandra. Sandra is 67 years old. She spent 31 years as a postal carrier in Roanoke, Virginia, on her feet 6 hours a day, 6 days a week, in rain and heat and snow. She was not the kind of woman who sat still. She was not the kind of woman who ignored her health. But at 64, her doctor told her something that changed everything. Type 2 diabetes, A1C of 8.3, and a prescription for metformin. Sandra did everything the pamphlet said. She switched to whole grains, she cut soda completely, she walked every morning same as always, and 3 months later, her numbers had barely moved. When she sat across from me, she looked more exhausted than confused. She said, and I remember this clearly, she said, "Doctor, I feel like I am fighting a war with no map." She was right. She had never been given the map. She had been given a prescription and a pamphlet and sent home. And the one thing, the most important thing, had never been explained to her at all. I am going to explain it to you now, because you deserve the map. Let us start with the villain in this story. And I want to be very clear. The villain is not your doctor. Your doctor is working inside a system that gives them 7 minutes per patient and a billing structure that rewards procedures, not education. The villain is not a person. The villain is a gap, a massive, inexcusable gap between what the research shows and what actually reaches you. Here is what the research shows. Inside your body, there is a hormone called vasopressin. You may also hear it called antidiuretic hormone, or ADH. This hormone has one very well-known job. When your body detects that water levels are dropping, vasopressin signals your kidneys to conserve fluid. It tells them, hold on to what we have. That sounds helpful, and it is. Except vasopressin has a second job that almost no one talks about. It also tells your liver to release stored glucose into your bloodstream. Let that sink in for a moment. When you are even mildly dehydrated, your body is actively pumping extra sugar into your blood. Not from food, not from a sweet drink, from your own liver, responding to a hormone that gets triggered the moment your fluid levels dip. Now, Think about your morning routine. You sleep for 7, 8, maybe 9 hours. During that time, you breathe out moisture with every exhale. You lose fluid through your skin, your kidneys keep working. By the time your alarm goes off, your body is already operating at a water deficit. And what do most people do first thing in the morning? They go straight for the coffee. Maybe they take their medication. Maybe they eat breakfast. And the water just sits there on the counter. By the time vasopressin has already kicked in, already told the liver to release glucose, your fasting blood sugar number is already being written. Before you have taken a single bite of food, before you have taken a single step. This is why Sandra's fasting glucose stayed high. Not because she was failing, because she was thirsty every single morning. And nobody ever told her. Here is what makes this even more critical. If you are over 60, and I need you to really hear this, the thirst mechanism weakens with age. This is documented. This is not controversial. Research from the National Institute on Aging confirms that older adults consistently underestimate their own level of dehydration. Your brain's thirst signal loses sensitivity. So the internal alarm that should be telling you to drink is already broken. You can be significantly dehydrated and feel completely fine. No dry mouth, no dizziness, no obvious thirst, just a number on your glucose meter that makes no sense. And a doctor who adjusts your medication when the real answer was on your counter the whole time. Think of your blood like a pot of soup simmering on the stove. As the water evaporates, the soup gets thicker. The flavors concentrate. The sugar concentrates. Your blood glucose readings go up, not because you added anything, but because the water that was diluting everything has slowly disappeared overnight. That is dehydration's second attack on your blood sugar. First, vasopressin triggers liver glucose release. Second, the blood itself becomes more concentrated, making your readings look even worse than they actually are. Two mechanisms working against you simultaneously every single morning. Now, I want you to think about something for a second. How many times has your blood sugar been adjusted? How many medications have been tweaked? How many doses increased because of a fasting number that was being inflated by dehydration? How many times were you told your diabetes was getting worse when what was actually happening was that nobody asked you how much water you drank before bed? That question used to keep me up at night. And here is where the medical system fails you. Not out of malice, out of structure. In a 7-minute visit, a doctor can check your A1C, they can adjust your metformin, they can print a nutrition sheet. What they cannot do is sit with you for 40 minutes and walk through the biochemistry of vasopressin, cortisol, and morning glucose in the way that actually changes behavior. There is no billing code for teaching you how to drink water correctly. That is the gap. That is the villain. Not a person, a system. And today, right now, you are stepping outside that system. You are getting the 40 minutes your doctor never had. Sandra's story is not over, not even close. What happened after we changed just one thing about her morning routine, I will tell you in a few minutes. Because the change in her numbers surprised even me. But first, I need to give you 3 mistakes. 3 specific things that most people managing blood sugar are doing with water every single day that are actively making things worse. Because knowing what not to do is just as important as knowing what to do. Here is the critical part. Mistake number 1, waiting until you are thirsty. I know that sounds obvious, but stick with me. The thirst mechanism in most adults over 60 is running at maybe 60 to 70% efficiency. By the time your brain registers thirst and sends that signal to your mouth, your body is already somewhere between 1.5 to 2% dehydrated. That number sounds small. It is not. Research published in the European Journal of Clinical Nutrition found that even 1.4% dehydration is enough to impair cognitive function and mood in adults over 60. More importantly for our conversation today, that same level of dehydration is enough to trigger vasopressin release. So, by the time you feel thirsty, The hormone has already fired. The liver has already released glucose. The damage to your morning reading is already done. Waiting until you are thirsty is reactive. Your body needs proactive hydration. Water on a schedule, not water on demand. Mistake number 2, drinking a large amount of water all at once to catch up. I hear this constantly. Someone realizes at 2 in the afternoon that they have had almost nothing to drink. So they grab a 16-ounce glass and finish it in 60 seconds. Problem solved, right? No. And here is why. Your intestines can absorb roughly 6 to 8 ounces of water every 15 to 20 minutes. Anything beyond that travels past the small intestine before it can be absorbed, gets processed by the colon, and heads straight to your bladder. You feel full. You feel like you drank, and you are still dehydrated. It is like trying to water a completely dried out pot of soil by dumping a full gallon on it at once. The water runs straight through, it does not reach the roots, the plant stays thirsty. You have to go slowly, in stages, giving the soil time to absorb each amount before adding more. Your body works exactly the same way. Small amounts, consistent rhythm, throughout the day. Mistake number 3, and this one surprises people. Ice cold water first thing in the morning. Look, on a hot summer afternoon, cold water feels amazing. I understand. But in the morning, when your digestive system has been dormant for 8 hours, ice cold water triggers something called cold-induced vasoconstriction. The blood vessels in your gut tighten briefly in response to the temperature shock. Here is why that matters for blood sugar specifically. Your insulin needs those blood vessels open and flowing to efficiently shuttle glucose out of your bloodstream and into your cells. Even a temporary reduction in gut blood flow affects how well that insulin can do its job. Not dramatically, not dangerously, but measurably. And when you are already fighting an uphill battle with your fasting glucose, measurably matters. Room temperature water, or slightly warm. That is the target first thing in the morning. Somewhere between 70 and 80 degrees Fahrenheit. Not hot, not cold, just neutral. All right, now you know the 3 things not to do. Let me give you the 4 things to do instead. I call these the 4 pillars, and I want to be very direct with you. These are not complicated. They are not expensive. They do not require a prescription or a supplement or a gym membership. They require a glass and water and a decision to start pillar 1. The morning ritual. This is the most important of the 4. Do not skip this section. Here is what most people do not understand about the morning window. Your insulin sensitivity, meaning how efficiently your body can actually use insulin to process blood sugar, is at its highest point of the entire day between approximately 7 and 10 in the morning. This is documented in research from Johns Hopkins University. The hormonal environment in your body during those morning hours is the most favorable it will ever be for blood sugar management. But that window is being wasted because vasopressin has already activated, because the liver has already started releasing glucose, because the blood is already more concentrated. And it all started because water was not the first thing that went in. So here is the protocol: before coffee, before breakfast, before your medication if possible, though if you take medication with food, discuss timing with your doctor. The very first thing you put in your body every single morning needs to be 10 to 12 ounces of room temperature or slightly warm water. Not a sip, 10 to 12 ounces. That is a little over 1 full standard glass. Add to that water a very small pinch of unrefined sea salt or pink Himalayan salt. We are talking about the amount that would fit on the tip of your pinky finger. Not a full quarter teaspoon, just a pinch. The kind you could barely taste. Why the salt? Unrefined salt contains trace minerals, sodium, potassium, magnesium, in natural ratios. These minerals help signal your adrenal glands that your fluid balance is being restored. And here is the connection to blood sugar that most people miss. In the morning, your body naturally produces cortisol. Cortisol is your wake-up hormone. It helps you feel alert and get moving. But cortisol also raises blood sugar. It signals the liver to release glucose to fuel your morning activity. That is its job. And in healthy amounts, that is fine. The problem is this. When you wake up in a dehydrated, mineral-starved state, the adrenal stress response intensifies. Cortisol spikes higher than it needs to. More glucose gets released. Your fasting reading goes up. Not from a health crisis, from a mineral imbalance that a tiny pinch of unrefined salt can help address. Now, a very important warning. If you are on blood pressure medication, or if your doctor has told you to watch your sodium, please do not add salt to your morning water without asking them first. The quantity I am describing is small, but if you are on a sodium-restricted diet or have kidney disease, this step may not be right for you. Ask your doctor. That conversation takes 30 seconds and could save you a complication. For everyone else, the morning ritual looks like this. Wake up, 10 to 12 ounces of room temperature water with a tiny pinch of sea salt, then coffee, then breakfast, then medication if that is your routine. The water comes first, everything else follows. And here is the part that makes this sustainable. You do not need willpower. You need a glass on your nightstand. That is the entire system. Put a glass of water on your nightstand before you go to sleep. When you wake up, it is already there. You do not have to walk to the kitchen. You do not have to make a decision. The decision was already made the night before. Most people quit healthy habits because they require decision-making in moments of low energy. Your morning self has no energy. Remove the decision. Put the glass there. Now. Sandra. Remember Sandra, the retired postal carrier from Virginia? When I first explained the vasopressin mechanism to her, she went quiet for a moment. Then she said something I will never forget. She said, "So my body has been working against itself every single morning and nobody told me?" Yes, that is exactly what had been happening. I asked her one simple thing, just one. Add the morning water ritual before anything else. Before coffee, before breakfast, before her medication. Room temperature, 12 ounces, tiny pinch of sea salt. Do it for 4 weeks and bring me the numbers. She was skeptical. I do not blame her. After 3 years of disappointments, skepticism was the rational response. But here is what happened in week 1. Her fasting glucose, which had been sitting stubbornly between 158 and 172 every morning for over 2 years, started showing up in the low 140s. Then the mid 130s. On day 11, she texted my office with a photograph of her meter 127. Her first sub 130 fasting reading in over 2 years. She wrote, "Is this real? Did this actually just happen?" Yes, Sandra, it was real. It happened. But I need to be honest with you about something. Sandra's results were on the better end of what I typically see. Your experience will depend on your current baseline, your medications, your overall health. Some people see changes in 1 to 2 weeks. Others take 4 to 6 weeks. A small number see modest changes. What matters is the direction, and the direction is almost always toward improvement. Do not stop after 3 days because you do not see dramatic change. This is not a drug that hits you in 48 hours. This is a metabolic correction. It takes time for the biochemistry to shift. Give it at least 4 weeks before you make a judgment. Now, if this is making sense to you, and if you want to keep receiving this kind of information, hit subscribe. New videos every week, every single one focused on the biology your doctor wants to explain but simply does not have time to. No supplements to sell, no agenda, just the science. Pillar 2, pre-meal hydration. This is where most people are leaving a significant amount of blood sugar benefit on the table. And the fix is almost embarrassingly simple. Drink 5 to 6 ounces of room temperature water exactly 15 minutes before each meal. Not during the meal, not after, before, 15 minutes before. Here is the mechanism. When you prehydrate before eating, you gently dilute the gastric environment and activate digestive enzyme secretion in a more gradual, measured way. This slows the rate at which glucose from your food enters the bloodstream. Not dramatically, but measurably. Think about it this way. You know what happens when you drop a cube of sugar into a glass of water. It dissolves quickly. The water around it immediately becomes sweet. But if you drop that same sugar cube into a larger volume of water, a pot, say, it dissolves slower. The sweetness distributes more gradually. Your blood is the water. Your food's glucose is the sugar cube. The more fluid in the environment, the more gradual the rise. A study published in the journal Obesity found that people who drank 500 milliliters of water 30 minutes before meals had significantly better blood sugar management and ate naturally fewer calories. 500 milliliters is about 17 ounces. We are talking about half that amount, 15 minutes before, which is more comfortable and still provides measurable benefit. The practical version. You set a phone alarm 15 minutes before each meal. When the alarm goes off, you drink 5 to 6 ounces of water. Then you eat normally. That is the entire instruction. Now, a critical warning. If you have congestive heart failure or chronic kidney disease, increasing fluid intake without medical guidance can be dangerous. Your kidneys or your heart may not be able to process extra fluid safely. This step requires your doctor's specific approval if either of those conditions applies to you. Please do not skip this conversation. I am serious about that. For everyone else, 5 to 6 ounces before each meal. Every meal, 7 days a week. Pillar 3, hydrating while you move. I want to ask you something. When you go for your walk, when you do your exercises, when you garden or work around the house, do you bring water with you? Or do you wait until you get back inside and then drink? If you wait, you are missing one of the most powerful windows for blood sugar management your body has. Here is why. When your muscles contract during physical activity, they absorb glucose directly from your bloodstream without needing insulin to do it. This is a completely separate glucose clearing pathway. This is why exercise is one of the most effective blood sugar tools available. The muscles act like a sponge, pulling glucose out of circulation, independent of your insulin situation. But that sponge needs water to work efficiently. Muscle cells that are even mildly dehydrated lose some of their capacity to absorb glucose. The sponge dries out and becomes rigid, less flexible, less effective. Research from Harvard Medical School found that even mild dehydration, defined as just 1 to 2% fluid loss, measurably impairs skeletal muscle performance and metabolic efficiency in adults over 60. That is the group this matters most for. The protocol is simple. Every 15 to 20 minutes of physical activity, drink 3 to 4 ounces of water. Do not wait until you finish. Sip while you move. Small amounts, steady rhythm. That water bottle you keep meaning to bring with you, bring it today. Keep it visible. Not in your bag, in your hand. The habit follows the cue, and the cue is seeing it. And here is something else that is worth knowing. A small number of published studies have suggested that cinnamon, specifically Ceylon cinnamon, not the cassia variety you find in most grocery stores, may have a modest supportive effect on insulin sensitivity. The proposed mechanism involves compounds in Ceylon cinnamon that may mimic some insulin functions at the cellular level. This is preliminary research. The evidence is not strong enough for me to tell you to take cinnamon as a treatment. But if you enjoy the flavor and want to add a pinch to your water bottle during exercise, the risk is extremely low for most people. I want to be direct about the limitation. This is not a proven blood sugar treatment. It is a low-risk option that some people find helpful. One critical warning. If you are taking blood thinners such as warfarin or Eliquis, cassia cinnamon contains a compound called coumarin that can interact with anticoagulant medications and increase bleeding risk. Only use Ceylon cinnamon if you take blood thinners, and even then speak with your doctor first. Additionally, if you are taking diabetes medications that lower blood sugar, adding cinnamon that may further lower blood sugar could cause your levels to drop too low. Monitor carefully and discuss with your pharmacist. Pillar 4, the nighttime routine. This one surprises people the most. And I want to explain the biology carefully because the instinct here is backwards for most people. Most people think if I drink water before bed, I will be up all night. So they stop drinking water after dinner. They go to bed already mildly dehydrated. And then vasopressin activates in the night. And by 5 in the morning, the liver has been releasing glucose for hours. And the fasting number in the morning makes no sense. Here is the fix. And yes, it involves drinking water before bed, but not the amount you are imagining. 4 to 6 ounces of room temperature water taken 20 to 30 minutes before sleep. That is it. 4 to 6 ounces, less than a standard juice glass, consumed slowly, not gulped. The goal is to give your body just enough fluid that vasopressin does not spike overnight, not enough to overload your bladder. For most people, 4 to 6 ounces taken 30 minutes before bed does not cause a nighttime waking. If you are already waking multiple times a night for other reasons, time the water for 45 minutes before bed instead of 30. Now here is an additional option for nighttime that I want to raise carefully. Some research, including a meta-analysis of 13 randomized controlled trials published in the journal Nutrients, found that magnesium supplementation was associated with significantly lower fasting plasma glucose in people with diabetes or high diabetes risk. Magnesium is a cofactor in over 300 biochemical reactions in the body, including the reactions that govern insulin signaling at the cellular level. People with type 2 diabetes are known to have chronically lower magnesium levels compared to healthy controls. If you are magnesium deficient, which is more common than most people realize, restoring those levels may support your blood sugar management. The forms of magnesium with the best absorption evidence are magnesium glycinate and magnesium citrate. Typical supplemental doses studied were in the range of 200 to 300 milligrams. But here is the warning I need you to hear clearly. If you have kidney disease, magnesium supplementation can be dangerous because your kidneys regulate magnesium excretion. Impaired kidneys may not be able to clear excess magnesium safely. Do not take magnesium supplements without explicit approval from your doctor if you have any kidney issues, including reduced kidney function shown on your lab work. Additionally, magnesium can interact with some antibiotics and osteoporosis medications like bisphosphonates. If you take any of these, space the magnesium at least 2 hours apart and confirm with your pharmacist. If your doctor gives the green light, 4 to 6 ounces of water, 20 to 30 minutes before sleep with your magnesium supplement if appropriate. That is the nighttime pillar. Now, let me tell you what happened to Sandra, the rest of the story. It took her about 3 weeks to get all 4 pillars going at once. She started with the morning ritual in week 1. By week 2, she added the pre-meal hydration. By week 3, she was carrying a water bottle on her walks and doing the nighttime routine. At the 12-week mark, she came back for her follow-up. Her doctor had already run an updated A1C. It had dropped from 8.3 to 7.1 in 12 weeks, with no medication change. The same metformin dose she had been on for over 2 years. Her doctor asked what she had changed. She said, "I changed how I drink water." Her doctor, to his credit, said that is actually consistent with what the research shows. He had just never had the time to explain the research. Her morning fasting glucose, which had refused to drop below 150 for years, was now consistently landing between 118 and 132. Sandra told me the most meaningful part was not the numbers. It was that she finally understood why. For 3 years, she had felt like a failure, like her body was broken and would not respond no matter what she did. Now she understood the mechanism. She understood what had been happening every morning while she slept. And that understanding, that map, changed everything. She was not broken. She had just been missing information. And that is the thing that I keep coming back to. People do not fail at managing blood sugar because they lack discipline or willpower or motivation. They fail because they are working without the map. They are fighting a battle they do not fully understand. Today, you have the map. Now, before I give you the complete protocol summary, I need to talk about the bonus section, the drinks that are quietly destroying your blood sugar management. Because it does not matter how well you follow the 4 pillars if you are also putting these into your body. This is where the food industry has genuinely failed you. And I want to call that out directly. Number 1, diet soda and zero sugar drinks. I know, you already gave up regular soda. You switched to diet, you feel like you made the responsible choice. And in terms of calories, you did. But the relationship between artificial sweeteners and blood sugar is more complicated than the label makes it look. Multiple studies, including research published in the journal Nature, have found that artificial sweeteners can alter gut microbiome composition. And here is why that matters. The bacteria in your gut play a direct role in how your body responds to glucose. Disrupted gut bacteria can impair the glucose tolerance response, meaning your blood sugar swings harder even from the same food. Additionally, many diet sodas contain phosphoric acid. Phosphoric acid competes with magnesium for absorption in the gut. We just talked about how important magnesium is for insulin signaling. You may be drinking something that specifically blocks the mineral your blood sugar system needs most. This is not a reason to feel ashamed if you drink diet soda. You were told it was the safe choice. You were not given this information. But now you have it. The replacement I recommend is simple. Plain water with natural flavoring, a wedge of lemon, lime, or orange, a few fresh mint leaves, a thin slice of fresh ginger, cucumber ribbons. These additions are nearly zero impact on blood sugar, make the water genuinely pleasant to drink, and do not disrupt your gut bacteria or block your magnesium. Number 2, fruit juice. And I know this one will surprise some of you. Orange juice, apple juice, grape juice, even the kinds that say 100% juice, are concentrated sugar delivery systems. The fiber that would have slowed glucose absorption in the whole fruit has been completely removed. What you are left with is essentially a glass of natural sugar with a vitamin attached. A medium orange has about 15 grams of sugar with the fiber to slow its absorption. An 8-ounce glass of orange juice has 20 to 25 grams of sugar with no fiber. That juice hits your bloodstream faster than a candy bar in terms of the glucose spike it produces. Eat the whole fruit. Skip the juice. Number 3, and this is the subtle one that people do not expect. Your morning coffee, when it is the first thing in your body. Let me be clear. I am not telling you to give up coffee. I would never do that to you. Coffee has actually been associated with reduced diabetes risk in multiple long-term studies. That is not the issue. The issue is sequencing. When you drink coffee on an empty, dehydrated stomach as your very first act of the morning, caffeine stimulates your adrenal glands to release adrenaline and intensifies the cortisol response. Cortisol, as we discussed, signals the liver to release glucose. You have consumed nothing with sugar, you have consumed nothing with calories, and your blood sugar is already climbing. Water first, coffee second. That is the entire intervention for this one. You do not have to give up coffee. You just have to drink water before it, 10 to 12 ounces. Then your coffee, the cortisol response is significantly blunted when you are properly hydrated. Now, here is something I need to say very directly. Some of you watching have been struggling with this for years. Some of you have already tried so many things that failed, and part of you is waiting for this to fail too. I understand that. That skepticism is earned. You have been let down before. So let me tell you exactly what to expect over the next 4 weeks. Because when people know what is coming, they stay with it. And staying with it is everything. Week 1. This is the hardest week. Not because anything bad happens, because nothing dramatic happens. Your body is adjusting to a new fluid rhythm. You may find yourself going to the bathroom more often than usual for the first few days. That is normal. That is your body flushing out what it has been holding on to. Push through. Most people want to quit during week 1 because they expect instant results and do not see them. The people who quit in week 1 never get to see what happens in week 3. Week 2, you will start noticing small shifts. Maybe your fasting glucose ticks down by 5 or 10 points some mornings. Maybe your energy in the first hour of the day feels slightly different. Nothing dramatic yet, but something is moving. Pay attention to it. Write it down. Week 3, this is when most patients call me. This is the breakthrough week. The vasopressin pattern has been disrupted long enough that the liver is releasing less glucose on its own. The morning numbers start landing in a range that might feel unfamiliar and good. For many people, week 3 is when they first believe it is actually working. Week 4, consolidation. The new routine feels less like a discipline and more like just what you do. The numbers are more consistent. The unpredictability that was so frustrating has reduced. You have a system that your body is starting to trust. Weeks 4 through 12. This is where the A1C begins to reflect the daily changes. Remember, the A1C is a 3-month average. You will not see a 1C improvement in the first 4 weeks, even if your daily numbers are dramatically better. Be patient with the A1C. Trust what you see on your meter every morning. Now, here is the complete 4-pillar protocol for you to write down or screenshot. Pillar 1. Every morning, before anything else, 10 to 12 ounces of room temperature water with a tiny pinch of unrefined sea salt or pink Himalayan salt. Do this before coffee, before breakfast, before checking your phone. Put the glass on your nightstand the night before so there is no decision to make in the morning. Pillar 2, 15 minutes before each meal. 5 to 6 ounces of room temperature water. Set a phone alarm if you need to. Drink slowly over 2 to 3 minutes, not gulped. Let it settle before you eat. Pillar 3. Every 15 to 20 minutes of physical activity. 3 to 4 ounces of water. Bring a water bottle. Keep it visible and in your hand. If you enjoy cinnamon and your doctor has approved it, a tiny pinch of Ceylon cinnamon in the bottle is a low-risk addition. Pillar 4. 20 to 30 minutes before sleep, 4 to 6 ounces of room temperature water, slowly. If your doctor has cleared magnesium supplementation, take it with this water. Start at the lower end of any recommended dose and give it 4 weeks before judging the effect throughout the day. Your general daily target is roughly 30 milliliters per kilogram of body weight. In pounds, that is about half your body weight in ounces. If you weigh 160 pounds, aim for 80 ounces across the day. Distribute it evenly, not all at once. The simplest monitoring tool you have is the color of your urine. Pale yellow means you are hydrated. Dark yellow means you need more water right now. Clear means you may be overhydrating, which can deplete electrolytes. Pale yellow is the target. Now, let me ask you something. Of these 4 pillars, which one do you think you can start today? Not tomorrow, not next week, today. Write it in the comments, write the number 1, 2, 3, 4. And if you have already been doing one of these things, tell me that too. Because your experience might help someone else watching right now decide to start. If this video has given you something real today, something you can actually act on, please like it. Not for me, because the algorithm will show it to someone else who is sitting exactly where you were sitting at the start of this video. Fighting a battle without a map. Feeling like a failure when they are not failing at all. They are just missing information. Your like changes that, and share this video with one person. Not everyone on your contact list. One person. The person whose face is already in your mind right now. Your sister who has been struggling with her numbers for years. Your neighbor who just got diagnosed. Your husband who keeps saying his sugar is fine and it is not. One person. Send it to them today, not tomorrow, today. That act of sharing might be the most important health decision that person has ever had made for them. Subscribe and hit the bell. Next week, I am going to show you something that very few doctors are talking about yet. The connection between sleep quality and fasting blood sugar. If you wake up tired every morning, even after a full night of sleep, and your fasting glucose is consistently high, there is a specific hormonal chain happening in your body during the night that most people have never been told about. That video could change everything for you. Do not miss it. And if you made it this far, I want you to know something. The fact that you are still here, still learning, still looking for answers, that is not desperation. That is wisdom. You are doing the right thing. You are taking your health seriously in a world that makes it very easy not to. Do not let anyone tell you it is too late, because it is not. Sandra is proof. Your body has a remarkable capacity to respond when you finally give it what it actually needs. Not more medication, not another restrictive diet, sometimes just water. At the right times, in the right amounts. With the understanding of why. You have the map now, use it. I will see you next week.